Hi guys, today we're going to be talking about vitamin D if you have low thyroid symptoms or Hashimoto's thyroiditis. A lot of the patients who are coming in now to our office with chronic conditions are already on vitamin D, and most of them have not even been tested for vitamin D. Now vitamin D is different than some of the other vitamins. You've probably heard of water-soluble and then fat-soluble vitamins. Water-soluble is like a vitamin C. You get too much vitamin C in your system, what happens? Just pee and poop it out. No problem whatsoever. Now if you take a fat-soluble vitamin, that gets stored in your fat deposits and doesn't get out of your system quite as easily. That's what vitamin D is. They also say it's a hormone as well. So that's something that you don't want to just take willy-nilly. Okay, and you might be saying, well, hey, my doctor did a test on me and he said that I was low in vitamin D, so that's why I was put on vitamin D, so I'm okay. Maybe, probably not. The reason being is that most doctors out there are only checking what's called your circulating vitamin D, a 25-OHD test. And that doesn't test to see how much your body is storing of the vitamin D, just how much is circulating around in it, because those two numbers can be drastically different. On average, about once a week we find a patient, at least one patient, who are taking actually too much vitamin D, or at least their stored vitamin D levels are too high. There's several reasons why this can happen. I'll try and keep it kind of simple here for the video purposes, but whenever you have an autoimmune condition, you can have problems with your vitamin D being assimilated and utilized in your body the way it should. A lot of times this will happen. Even if the patient isn't taking vitamin D, they can have the stored levels very high. So if you have some type of chronic condition, you need to get checked out. You need to go to a doctor who understands to check for what your circulating levels are as well as what your stored levels are, because you want both of those in the happy medium. You don't want one too high or one too low. Now vitamin D is important. It's been shown in deficiency and risk of breast, colon, and prostate cancer. So it's important to have adequate levels of it, but you don't want too high levels. A lot of times what will happen is patients will come in and they'll say, yeah, I was tested, and now I'm taking 50,000 units of vitamin D every Monday because my doctor said I was low in it. But the rest of the week they don't take any. To me that makes no sense, because if you have a deficiency of something, doesn't it make more sense to take a little bit of it every day to increase your levels as opposed to one big whopping scoop of it at one time? I'll just let you know, yes it does. So that's not our recommendation. So if you're out there taking vitamin D, you need to talk to your doctor and see if you can't get tested and find out whether you're circulating levels of D as well as your stored levels of D. And if your doctor doesn't know this, then what you need to do is ask your doctor to find out how to do that, or find a doctor who knows what we've just talked about. And if you haven't had your D checked and you're having low thyroid symptoms, you need to get that checked as well. Dr. Heimlich, thank you very much.